Okay, welcome back from the break. And we did have a caller at the break. His name is David. David, are you there? Back from the break, and we did have a caller at the break. His name is David. David, are you there?
I'm here.
Okay, so what's your question, David?
I'm here. Do you hear me?
Yeah, you got a lot of background noise, so I don't know if you have a TV on or something.
Well, I've just weaned myself off of some hydrocodone. I've had what they call spinal stenosis. That is the most painful thing I've ever had. What I want to know is about this medical marijuana. I'm
Sir.
not a dope fiend. I don't drink or smoke. I just wonder how safe that stuff. I've been warned against that stuff since I've been a little kid. And I'm 85 years old now. I'm just wondering if it's safe to start messing with that stuff. Medical marijuana.
Well, medical marijuana, if you sort out the people that are using it recreationally and the people that need it for pain, I've seen a few patients that do use medical marijuana and do get pain relief, and that's what they basically tell me. For people that don't want to smoke it, you can grow it until the dispensaries open up, and you can actually put it in what they call edibles and have it in like brownies or things of that nature, which may not be good if you're a diabetic. But there are people that basically do say that it does cause or does help with pain relief. And so this is a topic for another whole show, but I will say that if that's something you choose to do, please become legal with the state. We do have patients that we advise to fill out the paperwork with the state of Nevada to become a legalized marijuana user, or at least an announced marijuana user. When you come to see me for pain medication and I test you for what you're taking and I find that you're taking marijuana but you're not telling me about it, that could violate the controlled substance agreement that I have with my patients. And we have an agreement. Some people will terminate a contract, but we don't like to terminate a contract because it's not really a contract. It's just an agreement and an understanding. And you're supposed to be honest with your physician and tell them everything you're taking. There's no drug-to-drug interaction between marijuana per se and its degradation with the other products. There can be a summation effect with marijuana with other drugs, meaning it potentiates the effect. And again, a lot of people argue marijuana is a gateway drug to other particular things, and for people that use it recreationally that want to escape, yes, it is. That's true for any pain medication, any type of thing that you choose to use to escape from the day-to-day reality, then that is a problem. People that smoke marijuana for pain relief will smoke it only when they need it. You are subject to the same rules of driving under the influence and things of that nature, and I believe, and I don't know for sure, I believe the drug testing for marijuana is, I heard, as low as 10 nanograms, which is a pretty low dose of marijuana, meaning that frequent users will turn up at a 20 nanogram. 20 nanogram will detect the usage within a month. So a 300 nanogram detection limit usually will pick it up within 3 or 4 days, meaning the higher limits, your body will degrade it. Marijuana does stay in your system a long time. It has a lot of good points and it has a lot of bad points. But I believe that if you're going to benefit from it, then I'm all for it, and you do have chronic pain. Enough said on that. Hope that answers your question. Anyway, next slide. Which was within 5 years of quitting smoking, your risk of stroke is the same as a non-smoker, and the risk of many cancers, mouth, throat, esophagus, bladder, and cervix decrease significantly. Now, let's talk about two of those which are really significant. The throat cancer, if you drink and smoke, and a lot of people do, it's not will you develop throat cancer, it's when will you develop throat cancer. 100% of the people who drink and smoke will develop throat cancer. Keep that in mind when you're having a cigarette, sipping on that scotch or that bourbon, okay? You will develop throat cancer. Very nasty disease. Cancer of the bladder, real big problem because the nicotine and all the benzopyrenes are concentrated in your bladder and the urine. So that's where you see a lot of bladder cancers, transitional cancers. and of course, smoking increases the risk for all cancers. Next slide, within 10 years, the risk of dying from lung cancer is cut in half, and the risk of larynx and pancreatic cancer decreases. So smoking and the benzopyrenes and the nicotines, not nicotine, but the benzopyrenes and the carcinogens are what they don't measure in your urine and in your body, but these are the things that last and can cause cancers. And the older you get, obviously, the more likely your cancers are formed. Within 15 years, your risk of heart attack basically drops to a level of non-smoker, and the risk for COPD also decreases a lot depending on your age. Basically, one of the reasons people quit smoking is because they're worried about weight loss, and it is weight gain. It is true that if you quit smoking, you will gain about 4 to 5 kilograms, or 8 to 11 pounds within 12 months of quitting smoking. But trust me, the weight gain is minimal compared to the benefits you will receive from reducing your exposure, not to mention how rich you'll be at a pack a day. A pack a day could be $5, $6 a day. Well, you do the math, that's $1,800 to $2,000 a year. If you were 20 years old, and I'm not an investment, so banker or advisor, but if you could get a guaranteed return of 8 to 10%, and you put $2,000 away for 20 to 30 years and didn't touch it again to your 65, you'd have quite a tidy sum. So think about that when you're going out buying a pack of cigarettes. And of course, this is a very lengthy explanation on why people tend to gain weight when they quit smoking. But usually what ends up happening, we tend to eat, because smoking is a blocking agent, and it does block. We use it as a buffer between us and what's going on. So when we're not smoking, we're stuffing something. I mean, we're stuffing this in our face so we don't have to deal with an angry boss or an angry client or whatever it is that's going on. When we stop smoking, we tend to eat a lot in that same thing. We've got this oral fixation going on. There's also an explanation, smokers who are basically heavy smokers, I think that's an interesting fact, burn almost 200 calories per day more than non-smokers eating the same diet. And there is a hormonal explanation for that, but trust me, smokers, they breathe harder, their heart rate is up, they're vasoconstrictor, and they tend to eat less. So that's probably the 200 calories. And 200 calories a day is 20 pounds a year. Remember my talks on weight gain and how much 200 calories a day could be a significant amount of weight. Smokers who have major depression will be less likely to quit smoking, and that is because smoking itself creates some depression as you go through, and your body is used to a large amount of dopamine being secreted. It's not there. Those neurotransmitters that we talked about earlier are not there, and you tend to go through some depression. So people who are already suffering depression need to think about, they have a decrease in the ability to quit smoking. They get very depressed. So if you're already depressed, you may want to discuss it with your physician about being closely monitored while you're trying to quit smoking. In addition, all treatment have about a 25 to 30% success rate, of which the one that boasts the most is what number 3 bullet point. Chantix seems to have the best success rate, only because it uses a combination of a nicotine receptor analog as well as using a chemical neurotransmitter to help you deal with the ritual. But if you look at them, nicotine replacement, Zyban is an interesting drug because it really is Wellbutrin, which was an antidepressant, and why it helped people quit smoking, they didn't even know it. It was being used in the psychiatric wards. All of a sudden they noticed that patients that were on Zyban no longer were smoking, or majority of them were no smoking within 3 to 6 months. So they basically changed that in the name of Wellbutrin to Zyban, because if you were taking an antidepressant, the insurance companies would say you were depressed and wanted to rate you for higher insurance. Hypnosis, acupuncture, cold turkey, and a recovery-based program. That last one is a very important one. One of the things I used to help reduce and quit smoking was that I can do anything for 5 minutes that would for a lifetime be impossible. What that means is all I had to do was quit for 5 minutes at a time. I had to play a mind game with myself. And if you look at smokers and you look at the psychology of smoking, most people never give themselves a chance to say no. The cigarettes are in their pocket, they're in their car. They will leave home with their cigarettes and forget their wallet and their phone, but they will never forget their cigarettes. I mean, we're talking about a very powerful addiction. So with that being said, you can do for 5 minutes that would for a lifetime be impossible. I want you to think about that thought. This is going to conclude tonight's segment. Thank you very much for tuning in, Pahrump. I certainly enjoyed being your host on this show.